Good morning. My name is Joanne Bunch, and today I will be giving a persuasive speech on depression. And this morning we have in the audience with us Mrs. Deborah Colbreth. Good morning, Mrs. Colbreth.
Good morning.
How are you?
I'm doing great.
It's good to have you here with us here this morning.
It's good to be here.
We also have in the audience Mr. Toronto McLeod. Good morning, Mr. McLeod.
Good morning, guys.
How are you?
I'm okay.
This morning I will be giving a persuasive speech, and my general purpose is to persuade my audience into realizing that depression is in fact a disease that is far too often overlooked as such. Depression is a legitimate disease that exists with many people in this world. Does anybody here today have a loved one that suffers from depression? Does anybody know what depression is? And does anybody know what kind of an effect that depression has on people? These questions and more will be answered in my following speech this morning. Today, I will be talking about the challenges of depression. Then I will explain the causes and the symptoms of depression. Research suggests that depression does not spring from simply having too much or too little of certain brain chemicals. Rather, there are many possible causes and symptoms of depression. Lastly, I will discuss the treatment of depression. So why am I telling you this? And why should you listen to me? Well, because I have lived with symptoms of depression for many years, and I know what it feels like to be depressed. First, I'm going to talk about what depression is. Then I'm going to talk about what it does to people, what the causes are, and what are the symptoms. And lastly, I will be talking about what can be done about it as far as treatments are concerned. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Also called a major depressive disorder or clinical depression, it affects how you feel, it affects how you think, and it affects how you behave. Depression can lead to a variety of emotional and physical problems. Did you know that according to the National Institute of Health, depression strikes roughly 17 million people in the U.S. each year? 17 million. That's a lot, isn't it, guys?
Yes.
Depression disorders are classified as mood disorders, and depression is often referred to as an affective disorder. Depression is viewed as feeling sad, and here are some symptoms. And today, I have a PowerPoint, and I'm going to show you some pictures. First, I'm going to give you the symptoms of depression. Okay. Depression is viewed as feeling sad, and symptoms include depressed mood, difficulty concentrating, diminished interest of pleasure and activities, significant weight loss or significant weight gain, changes in appetite, insomnia, which means difficulty sleeping, hypersomnia is sleeping too much, agitation, fatigue, loss of energy, feelings of worthlessness, and lastly, suicidal thoughts and attempts. And as you can see in my PowerPoint, I have some pictures of some depressed people. And here's another PowerPoint. Okay. The causes of depression are abuse, certain medications, conflict, death or loss, genetics, serious illness, and other major events or personal problems. Although the exact cause of depression is unknown, imbalances of low activity of the brain chemicals called neurotransmitters are known to play a role in depression. Depression may have a genetic component, as the disorder can run in the family. Other conditions can cause depression, such as vitamin deficiency, potassium deficiency, brain tumor, stroke, cancer, and changes in brain chemistry. A formal diagnosis requires that at least 5 of these symptoms be present for at least 2 weeks. Additionally, at least one of the first 2 symptoms must also be present for a diagnosis. All depression disorders are diagnosed based on history and the symptoms. Major depression is the most severe form of depression and the one in which may present great risk of suicide. It is characterized by the recurrence of major depressive episodes. A range of effective treatment options exist for depressions. So here are some of the treatment options for depression. They include antidepressant drugs, psychotherapy, and convulsive therapy. Getting support from family and friends, peer support groups, self-help, proper care, and relaxation techniques may all help relieve symptoms of mild depression. But severe major depression usually requires both medication and psychotherapy. Even though depression is a very stressful and serious disease, we should always protect ourselves from becoming depressed. If you feel that you or someone you know have any symptoms that I have mentioned to you, you should get treatment or tell them to get treatment as soon as possible. If you are possibly depressed, ask your family and friends for help because they can be the most helpful people in your life. Today I have talked about depression. I've given you the background causes. I've given you some symptoms and the treatment options available for depression. According to the American Psychiatric Association, at least 3 in 10 people will become depressed in their lifetime. This means that 30% of you could suffer from depression. Remember, your loved ones are there for you, but do not hesitate getting professional help. Depression is a very dangerous disease that can affect you and your loved ones, especially throughout and during this pandemic. Thank you so much. And thank you, Mrs. Colbert, for being here. Do you have any questions?
No, I was just wondering about when you're talking about getting treatment for people that are depressed, how would you try to convince them that they need to try to seek help?
Well, I guess you can ask them what kind of symptoms they're having, and then you can discuss with them or ask them to discuss with their doctor because, like they said, if you got at least 5 of these symptoms, then you can get a diagnosis from your doctor of being depressed. Mr. McLeod, do you have any questions for me?
I really don't have any questions, but the way I gather is depression. If you got depression going on, that you should seek medical help or professional help or a psychiatrist, or talk to your family about it, or all the above. You know, especially if you got them symptoms too. That's the way I would go about it.
Okay. Well, thank you, Mrs. Colbert and Mr. McLeod, for being here, and thank you for your input and your questions, and thank y'all for listening to my speech. Goodbye.
Bye-bye.